So we're back now. Okay, so once again, welcome to another exciting episode of our Belle by Choice Facebook Live chat. And on today's episode, we'll be talking about how a woman can know how she has if she has breast cancer. How woman fit sabi say we have to switch to our pidgin language. How woman fit sabi say she gets breast cancer. This one na things wey dey happen around us. The symptoms dey dey, person no fit know sometimes. Even when e dey happen, you fit decide to just play blind to am. You fit decide to play blind to am, all in the name of abeg, I no sure say this kind thing dey exist. Sure say this kind thing still dey, but it is real. It's things that are still happening around us. So on today, before we proceed on the discussion for today proper, we want to take a minute to say a very big thank you to our amazing partners who have made this possible. So we're saying a very big thank you to AWDF, Global Fund for Women, Women First Digital, Gilead, Moment for Women Alliance, DKT International Nigeria, Cross River State Ministry of Health, UNFPA, and Cross River State Primary Healthcare Development Agency. Thank you so much for your support and want to say we love you. All right, so back to our discussion proper. So today we'll be having an amazing person to tell us about how woman fit sabi say she gets breast cancer. Madam Elsie, thank you for coming on the show today.
Thank you very much. Thank you very much. Thank you, viewers out there, for joining us on this exciting episode of our program today. You are all welcome.
Yeah, thank you too for making our time to be here. All right, so back to today's discussion. When we dey talk about understanding breast cancer, now that area we want start with first, because if person no get understanding about that kind thing, if you dey talk now, e go be like say you just dey waste your time, like you dey waste speed. So now, when we dey talk about understanding breast cancer and early detection, what are the common symptoms of breast cancer and how can one differentiate them from the other less serious conditions? For instance, now, person wey get cancer, e dey see the symptoms, e go think say na normal one now. If fit just underrate am. How the person fit differentiate am from the one wey dey less serious, wey dey like wey no dey very very serious like that, like the start stage of this condition. Abeg, over to you, Madam Elsie.
Okay. Thank you very much. First of all, our topic for today is how women feel sabi say they get cancer. And first of all, I would like to define what cancer is. Cancer is a group of disease characterized by uncontrolled growth and spread of abnormal cells. That is when you see things where we say you no suppose grow for your body. It is very pertinent, it's very essential that you don't overlook it. You seek medical attention. So one of those things where they grow for our body now, this thing called cancer. And when it happens like this, it can spread to different parts of your body. And for the course of our discussion today, we'll be focusing on breast cancer specifically. So now, what is this breast cancer? Breast cancer is an uncontrollable growth that occurs in the breast in particular. Now, this growth develops from milk producing gland, that place where milk they produce. So now, when it happen like that, if it is left untreated, or since sabi say na cancer they develop, so they no treat am, you no know, because say you no know, e fit spread to other parts of the body. So that is why it is very necessary for you to know those signs and symptoms, so that once you see them, you will be able to know that, okay, fine, this is breast cancer that they've been talking about. So one of the signs and symptoms of breast cancer is when you start experiencing breast lumps, that is something that is very strong for your breast. That is what is called breast lumps. And another one is changes in size. You notice say your breasts don't they increase. That's why it's very pertinent for a woman to be conscious of herself. Let her know her body. Observe, be observant. Don't be careless about your body as a woman. Because if you are conscious, you will notice that, okay, fine, no, one of these my breasts don't they increase. Oh, wetin dey happen like this? So if you notice say one of your breasts don't they increase, or the color don't they change, that is the appearance of the breast has started changing, or the size has increased. You should know that, okay, fine, this is one of the symptoms. So where that woman be mentioned that day, good. Another one be say you go get nipples discharge. If you dey notice say small small things dey come out from your breast and no be breast milk, e fit be blood fit come out. Because once this cancer set in, it can trigger a lot of things. So if you are noticing nipples discharge from your breast, you should know that this is a sign of cancer. And also you notice redness or dimpling. That is, if you touch am, e go dey soft. If you touch that part, e go dey soft. That is another sign that you can know that, okay, fine, this particular sign no good oh, make I go meet doctor. So these are the common symptoms that you can know, signs and symptoms that you can know. You also feel pains in your breast. As you touch your breast, e dey pain you. All the time e dey pain you, and you can't feel something like seed. That is the lumps I was talking about. You feel seed, a seed-like stuff inside your breast, which is very, very wrong. It's not supposed to be like that. So there is every need to seek medical attention. Now, although there are some things that can actually look like that. That is, they look like breast cancer, but they are not breast cancer. Example, a condition called benign tumor. That's a non-cancerous growth. It is not a cancer growth. Once you notice any strange things around your breast, which is not supposed to be like that, you should seek medical attention. And also cysts. Cysts can also cause pains in the breast, but it is not actually breast cancer. Those are the things that looks like breast cancer. So you should be able to differentiate the one that is breast cancer and the one that are not breast cancer. So another one is fat necrosis. That's trauma or injury causing fatty tissue damage. There are some people that are very fat. So once these diseases set in, it damages the tissues around your breast. So it might look like all those things, and it might cause pains. It is not breast cancer. So you should be able to know the one that is breast cancer. Now, one of the obvious things that will make you know what a breast cancer looks like is lumps. Lumps. Now, these cancer lumps are often hard. They are hard. They are strong. And they have a particular place that you can find them, always close to under your arms. That is how you can detect that, okay, fine, this one is different from the pains that I've been experiencing. And another one is for cancer, you experience persistent pains and nipples discharge or skin changes. Like from the image you are seeing, you will start having discharge from your nipples, which is different from the normal breast milk. Those are the things to differentiate between the ones that are not cancer and the ones that are cancer. So images, features. Looking at it physically, you will know that this my breast don't they change color. So not be like this in the day. So those are the things you will use to know that these changes, these physical changes are caused by cancer. Thank you.
All right, thank you very much for sharing that. So you dey talk say person wey get breast cancer go get the breast go dey change color. Abeg,
Hmm.
which type of color be that one wey dey show for the breast so that we go know whether na red or purple? Make we sabi the color so that us wey we no know now, make we kuku know at once.
Definitely, okay, definitely you have a redness of the breast.
Okay.
The color will start looking like something that is inflamed. If naturally, if you get pus for your hand,
Mm,
you go see that yellowish color. You go know say this place don change o, and e go begin from red color before you go reach that yellow. So you
mm,
start experiencing a redness of the breast. So you know that this particular breast don get kasala don happen o. So it's different from
okay.
this other one. So na the color wey I dey talk about be that.
Okay, thank you. E be like say you don already mention the different types of this breast cancer, but abeg, shey you fit expatiate on the stages?
Okay, now this breast cancer get different stages. At that initial stage, which is called stage 0, the cancer remains only in the milk duct. That is that place where milk dey produce. The cancer go remain there, e never spread yet o, and it is
Mm.
called ductal carcinoma in situ. Ductal carcinoma in situ. At that stage, na stage
Abeg,
0
wetin
be
be the
that.
meaning of that word? No vex.
Na the name of that first stage be that, ductal
Okay,
carcinoma in situ. That is,
okay,
the cancer remains at the milk duct, that place where milk dey produce for woman breast. The cancer just remain there o, e never spread yet.
okay.
Now when e reach stage 1, moving to stage 1, you know say any disease wey dey your body, na e dey start from small 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 small. So when e get to stage 1, that is, there is an obvious um sign. You will start feeling something obvious in the breast, in a particular region, that is the lymph node or other tissues that is around your underarm. As this woman dey carry her arm up, you go start to feel small small something. E go show say that cancer don dey increase o. That is the stage 1 of it. Now stage 2, the cancer will now grow and spread out to other parts of the body through blood, and na so e go keep on spreading. It will keep spreading like that. That is, as it grows further, it keeps spreading. That is from stage 1, stage 2, stage 3, stage 4. And if you don't know about it because of you lack awareness about the symptoms, that is, you don't know about it, it will keep spreading. But if you know about it from that stage 1, where be say you don dey feel those small small symptoms, you will now run to your healthcare provider and you explain, okay, fine, see wetin I dey go through, I dey feel pains under my arms and I come feel small seed inside. Oh, okay, that one is because you are aware of it. So from stage 0 to stage 4, it has 4 stages. Now when it gets to that last stage, that is the fourth stage, cancer spreads to other organs of the body, which will lead to other complications. That's how you have lung cancer, cervical cancer, because it don't spread. Now it is always pertinent. That is why it is very, very important for you to know about yourself as a woman. Be conscious of yourself and always engage in self-examination. Also, engage in clinical examination. It is not until when you feel all these pains before you start taking yourself to the hospital. Naturally, people don't like going to the hospital for checkup. It's not until you are sick before you should go for checkup. We can just go once in a while and say and ask your healthcare provider, okay, ma, please, I'm just here for a checkup. Yes, it's very good. So thank you very much.
Okay, oh, thank you very much for sharing that. Okay, so can you take us now on talk to us about the different factors, risk factors are associated with this breast cancer thing?
Okay, when it comes to the risk factors that are associated with breast cancer, they are caused by either genetic or environmental factor.
Okay.
Now, looking at the genetic factor, it could be sex, that is gender, is it male or female, who are more vulnerable to having this cancer. The people that are more vulnerable to having cancer are women. And age also matters. Family history too also matter. If you have someone in your family that has had cancer issue, there is this likeliness of you also having cancer problem. So it is always good to be watchful if you have a family history of cancer. So another risk factor is early menstruation. Early menstruation that could also lead to breast cancer and even late menopause. There are some people that at their age of 52, they are still menstruating. Now, when those hormones that are responsible for growth are still very active in you, there are possibilities that they can trigger this abnormal growth in your body. And also looking at the environmental factors, we have exercise. There are some people that don't exercise. And one of those things that can really cause this breast cancer is diabetes. When you are um, um, a, a diabetic patient, and also diet, the kind of diet that you eat can also trigger that. Increase in weight, you have increase in weight, that is you are um excessively you have like your weight is more than normal based on your age. That's what I'm trying to explain. It can also trigger that. Those are the factors that can trigger that. Smoking and taking of alcohol, it can also trigger all of these. These are environmental factors that can cause breast cancer, and it should be avoided.
Okay, thank you
All right.
very much. All
Yeah.
right, so talking about the importance of self-examination, you mentioned before, say make we dey examine ourselves. You know, say everybody, shey na in the morning wey person dey wake up, dey dress,
Mm.
wan go work, before e come back midnight. Some people sef dey wey dey stay for traffic, come reach their house around 11:30, 12. Shey you go get that kind time to do examination. Now, how important is this self-examination sef? And then can you guide us on the other proper techniques, like other proper techniques that could be done, like that would be experimented to avoid them contacting this breast cancer thing?
Okay, looking at self-examination,
Hmm.
this has to do with your own personal checkup in your house at the comfort of your home. That is, you have to check yourself as a woman. How do you do that? That you can do that by standing in front of the mirror with your hands behind you. Like if you're examining your left breast, you can do that standing in front of the mirror with your left hand behind your head, and you use your right finger to massage your breast. You're trying to like search if you can feel any lumps inside your breast. That is how you can do your own self-examination. And this should be done like you can do that in a month. And the best time to always do that is after your menstruation. After your menstruation, you can always do your own self-examination. Once in a month is okay. And also, self-examination is very important for early detection. Because if you engage in that, you will be familiar with your body. You will notice when there is an abnormal growth, or there is something that is not supposed to be present in your breast. But if you are this type that is always busy, you know that you will not be able to notice that, except when there is pains. And it can, another importance of this regular checkup, like self-examination, that is every month ensure that you check yourself every month. That's regular checkup. It helps for early detection. It improves treatment options and survival rates. Now, if you notice that you have breast cancer early and you meet with your healthcare provider, there will be treatment options given to you, and the rate of you surviving will be very high. You can survive it. Cancer is not something, you can only survive it if it is detected early. So if you allow it to remain in your body and it spreads to other parts of the body, you know that treatment might not really be effective. Yes, and the rate of you surviving might be low. So another one is for cancer prevention. That is why you must do regular checkup. The regular checkup must come in to prevent that cancer, because if you do it all the time, you are aware, you are conscious of yourself. Okay, fine, no, I don't want to have this. And it if it is present, they will be able to attack it immediately, and the cancer can be removed. Now, another thing is to reduce your high rate of mortality. Regular screening reduces um, cancer death. If you engage in regular screening, you can also, that is a clinical examination too. It can reduce the rate of you dying, and it can also increase your awareness. You can, you yourself, if you are aware that, oh, I should be examining myself every month, I think you'll be able to tell another person, ah, this is what you should do, or it is very important, so that you will not have breast cancer. So that is what is that is one of the, those are the importance of regular and self-examination checkup. And also another one that can also help prevent breast cancer is clinical examination, which is usually done by your healthcare provider. The self-examination is done, you are the one to do your self-examination, and it should be done monthly after your menstruation. Now, the next one that should be done is clinical examination. Once you discover that, okay, you felt any abnormal growth in your breast, you should talk to your healthcare provider, and also ensure to take records of how you are feeling the time that you notice these particular changes in your body. When you get to your healthcare provider, when you get to your healthcare provider, you should be able to tell her your medical history. Discuss with your healthcare provider. There are some people that don't like disclosing their medical history to their healthcare provider. But I will advise you that once you meet with your healthcare provider, open up to her so that she'll be able to know the treatment options to actually give to you. Imaging testing is also one of those things that can help you. That is, example is the mammogram, a low dose X-ray image of the breast. Now, this is used to view your breast and to ensure that um, there is no lumps in your breast. That is why it's always good for you to engage in clinical examination and self-examination. Thank you.
Okay, thank you. So the next we have is, um, what role does family history play in breast cancer risk, and should individuals with family history be more vigilant? So now, for instance, you don talk before say sometimes you fit trace am if person for your family get this cancer thing, this breast cancer thing. So it's most likely that you sef fit get am. So now, can you tell us now how this thing can be avoided? Like, what role does the family
Okay,
actually play in this breast cancer risk?
okay. Now, family history is one of the risk factor. That is the risk factor that I mentioned before. So, if someone from your family has breast cancer, there is every possibility that it can be transferred to the next generation. We call that first degree relative. That is either the father, child, or siblings. So if your parents had breast cancer, there's every possibility that you can have it because it's now genetic. It can be transferred through blood from one generation to the other. So there is every need for early screening. So you should start annual mammogram. That is, you should go to your healthcare provider. She will um, engage in, she will carry out that particular test for you, and also regular examination. Regular breast examination by healthcare provider is also needed. You cannot stay in your house and your healthcare provider will come and carry out that examination. So it's you that will carry yourself to the hospital. That is why it's always good for you to do regular checkup. Genetic testing is also necessary. If relative have a known history of gene mutation, there is every possibility that you can have it. So always talk to your healthcare provider so that they will know what next to do, and maintain a healthy lifestyle and stay informed about breast health screening recommended for you by your healthcare provider. Thank you.
Okay, well, thank you very much. We're talking about being vigilant. So how does vigilance come in this genetic thing? For instance, your papa and mama don't get them. You sef, you no know. You just born and you can't dey grow with them. Already they don't get am before they can't get you as pikin. Now, how does being vigilant even get involved now to solve this matter? You wey be small pikin wey just dey come.
At least it should we are now in a digital world whereby anyhow e be you go hear as dem dey talk am for radio. They used to give out health talks. You should even learn about it as a woman. You should learn about breast. What are those things I should not do to my breast? What are those things I should do to my breast? So you are trying to know about those things by learning, getting aware of it. So if you are aware of it, like now when we say we dey discuss about am, you draw closer to your radio or anywhere you are listening to us from. You don hear say one of those symptoms wey person fit get wey fit show say person get breast cancer na once im discover say lumps dey inside im breast. That is health awareness. You are aware of it now, so you should be careful. You should be careful about it. Avoid taking alcohol. Those There are some women that love taking alcohol. It is not good. So once you are aware of it, and another thing, you should always examine yourself. Self-examination is very important. So even if say you no know, say you no know, say e dey your family history, but as a woman you should always engage in self-examination. It's very important, so that once you just notice say I dey feel pains or my breast don change or the size of don increase, you go know say cancer don dey come so that is how you should be vigilant. You should get used to yourself. Thank you.
Okay, well, thank you very much. Thank you. Um, this thing
All
concerning
right.
this matter what you just mentioned, say some women they take alcohol to vessel. Might tell you, with the people still the way they say they use this drink, all this drink what they call hot, go use and mix some um things like that. They go tell you say na natural method of like natural herbal stuff wey dey treat malaria, typhoid infection, all those kind of stuff. So now as they use am mix am, you say make dem no dey drink am because some people dey take am now, they go say ah the thing don flush all the yamayama wey dey my body comot. So what is the risk of them taking this? Does it cause the breast cancer?
Okay. Now, what I'm trying to say is that because there are some people that you will tell them not to take alcohol, they no go here. They like calm. But just take calm at reduced amount. Don't take it excessively. It is bad for your body. Your body does not welcome that. It's not good. That's just what I'm trying to say. Don't take it all the time. There are some people that cannot do without
Okay.
alcohol. So you should just avoid taking it too
That's
much.
true.
Okay.
Okay. Thank you very much. All right. I think you already talked a bit about this, but I wanted to still throw more light on it. What are the latest advancements in screening methods for breast cancer, such as is it mammograms that you mentioned earlier,
Yes.
and
Okay.
the Maris. Okay, so the
No.
family, what's the family history of this one?
Okay. Now, all these things are just new technologies that are used to make sure that this breast cancer are detected. Like the mammogram is a low dose X-ray image of the breast tissue. It is a particular device that is used to ensure that breast cancer is being detected in women. We have a lot of them. We have a lot of them. And you know that X-ray naturally is not good. So now this mammogram is a low dose X-ray image. That's the rate of X-ray radiation that it comes with is in a low dose. So it is usually used for asymptomatic women. That is people who never develop them. So if you go hospital, you go discuss with your healthcare provider, okay, fine, I want to just do a general checkup as a woman. This can be used to detect if there is any lumps in your breast. And we also have another one. We also have image testing. Okay, now this mammogram is one of those things that are used to detect if there is any lumps in your breast. We also have biopsy. This particular one is for tissue. That is necessary if there is a tissue sample. A tissue sample will be taken. That is this biopsy process. A tissue sample will be taken for examination. That is, they will take one of a little tissue from your breast region for examination. So these are the latest screening that are recommended for breast cancer. And we also have CAD, that's computer aided detection device. This particular one, radiologists dey use am. Na devices wey dem dey use to just make dem know say okay, cancer dey o, cancer dey develop or e no dey develop. So all these things helps in detection of breast cancer. Another one is magnetic resonance imaging that you were trying to explain. It's This method uses a large magnet, radio waves, and a computer to produce a clear cross-sectional picture of the breast. like what I said, that all of these techniques are just used to ensure say these radiologists they feel view that cancer wey dey person breast. So it's just to help them see
Mm,
that growth that is actually happening inside. Even the microwave imaging
okay.
spectral.
Thank you very much. Oh,
Uh,
already this one you don't talk about. Oh,
okay.
thank you very much. You don't talk about this one already, but no need to ask you again because we already discussed about the importance of regular checkups before now. So person will be just dey join us. Make it go begin from beginning. When we don't finish the show, you go hear this one. This one, it dey important. Make you know. Thank you. All right. So and we will be going to the next question. So, what should someone do if they notice unusual changes or symptoms in their breasts?
Actually, when I started, I said that breast cancer can be treated if it is detected early. So the first thing for you to do, you are not to panic. If you observe changes, because there are some changes, like I made mention initially, that there are some changes that occurs in your breast and it is not caused by cancer. It is not a cancerous cell that is developing in your breast. So first of all, you don't have to panic. After you don't examine yourself finish, after self-examination, you discover that you have this breast cancer. All you need to do is just to um, document document the changes. That is, what are you observing? Because when you get to the hospital or any health facility, your healthcare provider will definitely ask you how they feel. Okay, when this thing been start. So it is very pertinent for you to observe those, to document those changes wey don happen around you. Example, take note of the date. Describe, you should be able to describe the location. Where is this thing really paining you? Is it under your arm or where? And another thing, immediately after you don notice say you dey feel something wey dey like seed inside your breast, that's an abnormal growth. You should book a visit with your doctor or any healthcare provider wey dey around you. You should immediately go to see them, because if you allow this thing to spread to other parts of the body or it remains in your breast, it will cause more complication and it will spread to other parts of your body. We mentioned the different stages. From stage one, e just remain for one particular place, e never spread though, and you are feeling small small pains. At that stage you should quickly visit a doctor and explain that. Afterwards, your healthcare provider will give you different options, like um going for a mammogram, image testing, and you should also ensure that you follow up whatever your healthcare provider is telling you. Get a clinical examination. That one now, your healthcare provider, after you don't go reach there, your healthcare provider will now tell you, okay, fine, let me examine you myself. After that, you will now discuss your medical history to your healthcare provider. I made mention initially that there are some people that usually hide their medical history. If you hide them, your healthcare provider no go fit sabi wetin to give you or to do. So it is always important, always disclose your medical history to your healthcare provider and follow up with whatever recommendation is given to you by your healthcare provider. And also know that early detection can improve treatment option. If you detect this thing early, from those signs and symptoms wey I don mention early, if you detect am early and then give you treatment, there is every possibility of the cancer vanishing from your body. But if it is not detected early and it is left untreated, there is high risk of you die not surviving this cancer, because if it spread to other parts of the body before they will come do all these screenings wey I don mention finish, come detect these small small places where you don go hide, it will take time, and there is high risk of you not surviving it. So early detection is very very important, and self examination is also very important. Always examine yourself as a woman every month. Once you finish menstruating, you should examine yourself every month. Thank you very much.
Okay. Oh, thank you very much. Oh, thank you very much. So before we go, I have personal concerns. You know, say before you go just hear some people say they get cancer. And by the time you know, they go say, now because you not go buy new brazier, you know, wash am, come wear. You know, say some people get that kind of habit for their body. Go just buy new clothes now. You never wash the cloth or the thing don dey hungry am to wear. Abeg, shey you fit advise dis women for dis attitude so dat dis one abi dis one no dey part of the things wey dey cause the breast cancer.
Okay, please, oh, our women and our young girls, keeping a healthy lifestyle is very essential as a woman. Another thing, looking at infection as a whole, we are fond of washing our panties. You dry it inside your house. It is very wrong. Always sun your panties. Look for a place where that radiation can touch your pants. And anytime you buy a new cloth or bra, please always wash your bra. There are some women that don't wash their bra. It is very wrong. It is very wrong. Please ensure that you wash your bra after usage. If you use am like 2 times, ensure say you wash am. No use am for whole 1 week. You still dey use am.
Anyway,
You carry am with all this. Abeg, I just dey beg you, abeg I dey beg. Just try and maintain a neat and healthy lifestyle as a woman. It is very very important,
okay,
because
well,
all
thank
this
you very
lifestyle
much.
can trigger
Mm,
something very bad.
that's all. Thank you very much for sharing light on that. So our viewers out there who are just joining with today, our discussion was on um, how woman fit sabi say she carry or she get breast cancer. And you know say different ways dey, as our speaker don talk, our expert don tell us say make we dey wash our bra, make you no carry one bra for 1 week. Your pint, make you dey sun dry am, everything, even though you just buy am today and you dey hungry, sorry, we know say new things dey hungry person to wear, but e dey important make you put am for sun too, make you wash am put for sun make sun touch am. Or better still, me wey I dey here so, when we bin dey grow, our mama go say, or we bin get people for there wey bin dey tell us say oya make una dey go iron una cloth. Una know say dis compound now you no fit dry things outside, you dey live for face me I slap you house. E no mean o, but at least since you no go fit dry am outside because of the way the world dey now, make you carry your iron. If your neighbor get iron, you too sef you fit borrow, use am iron your undies, even your clothes, make you iron dem. If dat iron don touch am, e go kill all the germs wey dey for the thing wey for don cause any cancer for your body, any sickness or infection at all. Because even sometimes when we dey buy okrika dey wear, so we no know who don wear am. E fit be say dem even comot am for dead body come carry am come market come sell. You sef you no know. Your own na to buy go wear. So if you buy am, make you remember to wash am well well. If you don wash am, especially pint, soak am. You fit soak am with hot water. If na white, use hypo. If no be white, you fit use Izal or any other thing, put am disinfectant make you pour for the water use wash, so that you no go carry am o, because this one dey no right for the cloth, dey no right for face. Cancer dey happen anyhow, e fit enter your body anyhow, so please make you dey prepare well. So thank you very much to our woman for telling us about this thing, and I know say our women wey dey hear, and even these young girls dem, they go learn how to dey wash their pints. Some of us wey we no dey wash before, from today wey you don hear am, make you dey start to dey wash am now, dey dry am for sun, or you iron am wella wella. Okay o, so if you be woman wey get unnecessary reproductive health needs, o, you fit call or WhatsApp our Belle by Choice padi hotline for the screen. I go call am for you, so that in case you wan call the number, make e dey free or easy for you. 070 480 65 450 rather, or you call 080 450 56486. Abeg, make you no forget to reach out to padi. Belle padi dey available, or you fit call our hotline. Our honey and banana connect also dey for the screen, 7790. Anytime, any moment, you fit reach out. Even for Ali, you fit chat Ali anytime for WhatsApp, you go get confirm answers wey you need. So make you no forget to visit any healthcare center wey dey close to you, whether you dey for Calabar or you dey for Ibiase, any local government wey you dey, either for Lagos here or you dey for Cross River or Akwa Ibom. No forget say healthcare centers dey available for you, wey you fit visit anytime, any moment. You go get all those needs wey you want. Tell them about your health matter. Remember, your health na your wealth o. Person wey dey alive na im fit dey alive to see tomorrow, e fit dey alive to go work, e fit dey healthy to go do anything, look for food chop. But if you no get strength for body, tell my brother, my sister, you no fit hustle am again. This life na hustle we dey, but as you dey hustle, make you remember say your health dey important, and your health should be your priority. So thank you for joining us on today's Belle by Church Facebook Live chat. So till we meet again next same time next week, Wednesday. We love you. Bye.
All right. Thank